Savna Jai Shri Krishna, Jai Jinendra, Jai Swaminarayan Sairam, and good evening to you all. And a very warm welcome to GAA London's final health webinar of 2025. Thank you all for joining us today. As we close the year, we are honored to host a session on two incredibly important topics: organ donations and lung cancer awareness and screening. These are subjects that impact many families within our community, yet are often surrounded by hesitation, lack of information, or cultural barriers. Today, we are privileged to have with us Prafulaji Shah, a remarkable community leader and health champion. Prafula is the chair of the Jain and Hindu organ donation charity, and she has traveled across the UK tirelessly, educating and inspiring communities to consider the life saving act of organ donation. Her work is deeply personal and impactful. In 2018, Prafula donated one of her kidneys to her niece, an act of courage and compassion that continues to inspire thousands. Along this, she has raised extensive awareness on several vital health issues, particularly within Asian communities where conversations around health can often be limited. So, in today's interactive session, Prafula will be guiding us through organ donation in Asian communities and why organ donation matters and what the process involves. A similar thing, lung cancer awareness and the importance of early screening, followed by an open Q&A. So this evening is an opportunity for each of us to learn, ask, reflect, and perhaps even shift our perspective. Together we can build a stronger, healthier, and more compassionate community, one informed choice at a time. So please settle in, share the link with families and friends who may benefit, and let's begin. It is now my pleasure to hand over to Prafula Shah. Prafulaji, all yours.
Thank you so much, Panaben, for that lovely introduction. Jai Shri Krishna, Jai Jinendra, Pranam, and good evening to everyone. I hope you're all well today. I'm going to talk about very, very different subjects, and they're not related in any way, but I have done these presentations recently, and Panaben was a guest of ours at our health fair, where she heard me speak. So it's an honor to be invited here today to talk about these two important subjects. And I'm going to start with organ donation. So as you said, I am the chair of the Jain and Hindu Organ Donation Alliance. Our work is very much around educating and raising awareness of organ donation in our communities, and specifically because we have some specific needs in relation to organ donation. And currently, there are 8,000 people waiting for organ transplant in England alone. So these are drastic figures, but they're not just statistics. They are actually people who could be someone's father, someone's son, someone's daughter, someone's mother. And they're waiting for not just one organ, sometimes multiple organs. We talk very much about organ donation as an act of seva, act of doing good for others, and an act of dan, which is inscribed actually in some of our scriptures. So when we talk about Hinduism and Jainism, and even Sikhism, these are acts of kindness that are inscribed in our scriptures. So from a faith perspective, organ donation is something that most major faiths of the UK support. And there aren't any faiths that actually say doing good for others isn't allowed. So I wanted to just frame that right at the outset and say, for us, people from the Indian subcontinent particularly, doing dan, doing seva, and doing good for others is something that is principled in all our faiths, all our major faiths. As Banaben said, a very personal thing for me, in that I donated my left kidney to my niece Shakti in 2018 at the Royal Free Hospital. It wasn't a decision that I took lightly because it's a major act that changed both our lives. And for Shakti particularly, it has given an incredibly new lease of life. And to see her now growing up and doing well in a career and, just living a wonderful life is something I've absolutely treasured, and I've been so privileged to have been given this opportunity to do good for her and others in the act of doing this. And that is because I wasn't a direct match to my niece Shakti. And when I say match, it's not just about matching blood types for organ donation. It's also about matching tissue types and other things. And we from the Asian communities have a bigger challenge in terms of some of this matching because there aren't enough people who step forward to do organ donation, either living or donation after death. And secondly, because we have some unique needs and unique DNA. So I wasn't a match to my niece Shakti, and we went through something called the UK Kidney Sharing Scheme, which in basic, simple terms is a kidney swap. So if there's somebody like Shakti needing a kidney and like me in the family or friend circle willing to offer a kidney, there might be other people in a similar situation around the UK somewhere who may be also waiting, but they have somebody willing to donate for them. So we all join what is called a chain, a kidney sharing chain. And that day, 6 surgeries happened around the UK where somebody donated and somebody received. So I donated my kidney so that Shakti could have a kidney, but actually in the act of doing this, I have also given somebody else that opportunity. So my kidney has gone to somebody I don't know because the whole process is anonymous. Process through the kidney sharing scheme is anonymous. Of course, you can donate directly to somebody you know if you're a direct match to them. But in my case, I don't know who that person is, and we don't know who Shakti has the kidney from. We're both doing very well. Shakti is doing brilliantly, and she announced her engagement earlier this year and is getting married next September. So for me, it's been an absolutely incredible journey. She's doing really, really well at work. And to see her living this life is incredible. She was 24 when I donated my kidney to her. But we've always known as a family that Shakti at some point will need this help because she was born with one kidney that wasn't functioning properly. So she only had one kidney, and even that wasn't functioning properly. And in the August of 2017, her one kidney, the actual kidney function went down to 7%. So she was very ill. But you would not think so looking at her, because we were told that as a child, when she was a child and she was going through all these tests and hospital visits, we were told that by the time Shakti is maybe 12, 13, she will need some help, maybe an intervention of a transplant or dialysis. In Shakti's case, she was actually 23 when this happened, so she went through schooling, although I have to say she missed more school than she was at school because she was very ill. But she went through all of that. She did her university degree at York, living away from home and still managing this condition. And then she chose to do her master's degree at King's College and then got a job. And it was that summer when she had got that first job that her kidney started to go downhill and the function went down to 7%. It was an incredibly frightening time for us, and of course more frightening for Shakti because she had the option of going on dialysis or waiting. And that wait could have been many years for her because we, from the Asian communities or South Asian communities, wait the longest in terms of the transplant waiting lists. And as I explained earlier, that's because, first of all, we have a greater need because of some health conditions such as high blood pressure, heart conditions, strokes, and secondly, because there aren't enough people coming forward to donate organs from our communities. So she could have waited any time up to 3 years, 4 years, and during that time she would have been on dialysis. She did do the training to do dialysis from home because she was very adamant that she wasn't going to be hooked up to a machine 3 days a week in a hospital. And those are very grueling sessions. So she didn't want to do that. She wanted to do the dialysis at home and still continue working. In her case, in fact, she did all the training, but she needed a very short period of time on dialysis because by the time we came to have the surgery in March 2018, I think she'd done it for possibly 2 months, 8 weeks, by the time she did the training herself to do it. And I went through so many tests, and it felt as though I had given all my blood away. So there were probably I went through many tests, including blood tests, scans, and the hospital was absolutely amazing in terms of these. So their priority is to make sure that obviously you're healthy enough to do this. And I felt as though I'd had probably several whole body MOTs by the time they'd finished with me and said, yes, you're good to go and you can donate. A very, very thorough process, all managed by the hospital, but the governing body in the UK for organ donation is called the Human Tissue Authority. And one final interview is done with somebody from the Human Tissue Authority who often asks lots of questions around, why are you doing this? What is your motivation? Making sure that you're not being paid either financially or another way to do it. And that's really important. So those final checks are done by the Human Tissue Authority. The hospital then asked me to sign the consent forms. And I was told, okay, a date will be set once we go into the kidney sharing scheme run. And the run is essentially a computer program that happens 4 times a year, and people are matched with people waiting. So we went into the January 2018 run, and the surgeries happened in March 2018. Since then, I've become an ambassador for NHS Blood and Transplant, and I spend a lot of time, as you said, Panaben, promoting organ donation in the community and out of the community as well. I've spoken at many conferences, being covered. My story was actually covered by the BBC, so my whole surgery was filmed live and covered by the BBC. And when I became chair of the Jain Hindu Organ Donation Alliance, I'd already been working with them for a number of years. And now, as chair, I feel that it's really, really important for us in our communities to see this as not just a humanitarian crisis, but as a health crisis, because currently of the 8,000 people waiting for an organ donation, 1/3 of those are from the South Asian communities. And in my daily time, I spend time visiting hospitals, sometimes the dialysis units. And when you're there, you see a lot of people from our communities in those dialysis units. So kidneys are the most sought after organ for transplants. And all I can say is appeal to everyone that, look, we believe in doing good for others. We believe in this as an act of goodwill to mankind. And so we should absolutely, consider living donation for somebody who may be waiting for a transplant in our own circles or in our own families. And of course, you can only do that if you're healthy yourselves, but also sign the organ donation register so that donation in death is something that we can all consider. And this process, again, as I was saying earlier, is governed by the Human Tissue Authority. You are still, as a patient, the number one priority for hospitals, and they will do everything they can to save your life. It's only when it's absolutely certain that your life is not going to be able to be saved that organ donation actually comes into play. And often organ donation is something that is very much talked about for some families at that point of need, or that point of, that thing happening. Someone's in hospital, they're about to lose their life. This might be the last time you're having that conversation with them. So we often say, well, actually, it's much better to have that conversation as a family beforehand, and, find a nice way to talk about it. We all talk about what should we buy this Christmas, for example, what kind of event we're going to have for our families. But this is also a very important topic to talk about, because if suddenly that subject gets introduced to you at a hospital bedside, when you are actually not in a very good space to discuss this, often families will override your own wishes and say no to organ donation. So very important, because your family is still consulted. Organ donation is still a choice, even though the law changed in 2020 to one of opt out, which basically means by default, all of us, you, me, everyone, is an organ donor. And what's happening because of that, we're not telling our families and friends what our wishes are, because we're assuming that everyone knows this. What is actually very important is still to sign the register yourself. And thank you very much. Someone shared that link in the chat, where you can go and sign the register. And then, most importantly, tell friends and family about your decision, so that should that ever be the case, you are going to be able to donate your organs in death. Your family can take that decision knowing that that would have been your wish, and they're able to respect that wish. Only 1% of people, this is 1% of the people that are currently on the organ donation register, go on to actually donate their organs. And that's because donation has to happen in hospital, or your death has to happen in hospital. There's only a finite amount of time that the medics have, the transplant surgeons have, to retrieve the organs and transplant them. So really important that you made the decision, signed the register, told your friends and family about it. And, organ donation is an act of kindness. It still remains a choice. If I told you currently NHS are running a campaign, an incredible campaign called Hope Takes Flight, and it's a Christmas campaign where one of our trustees of Indian Hindu Donation Alliance, Jay Patel, and his wife Seema, are talking about Ari, their son. He's 3 years old. He was 3 years old when he passed, and they donated his organs. And in this video, which is the new campaign from NHS Blood and Transplant, they're actually talking about that journey of how Ari saved several lives, including donating his heart to a little girl who has since written to the family to thank them. It's an incredibly powerful video, powerful story. I urge everyone to please go and take a look. The link is in the chat of that video as well. And Jay and Sina, like me, do incredible work, also ambassadors for NHS Blood and Transplant. And every time I've heard the story, or we've had Jay present the story anywhere, whether we're doing it face-to-face or online like me today, we get lots and lots of questions and lots of people going off and registering decisions. I'm very much hoping that you will take a look at that video and make your decision about organ donation. There are many people who will be on dialysis today in a hospital somewhere in the UK. Our charity supports a specific project with the Imperial NHS Trust. So we're doing work with Hammersmith, Ealing, and Northwick Park hospitals, where we have a facilitator from the community called she basically goes and talks to people in our own language about organ donation and the possibility of living kidney donation specifically. So Rekha speaks Gujarati and Hindi, and is currently supporting patients at these hospitals. And we have actually three families who we are currently working with and answering their many questions that they may have about the process of living kidney donation. On the donation in death side, I had a wonderful message today from somebody in India. So donation happens all around the world, and in India, it's a very different system to us here, where there is a universal system for the whole country, but it's a system where different states have different policies. But I have a friend who works in Gujarat on this very topic. She sent me a lovely message today about a young man who started a lovely charity, and he has passed. His charity was to work with women of domestic abuse, giving them a financial footing so that they can support themselves financially. He has passed away suddenly and donated 8 of his organs to somebody else. And it's an incredibly powerful thing to do, a very powerful story. And that he will go on to save many lives, same as anyone here who may donate organs in death. And you can donate, obviously, your lungs, your heart, your kidneys, your liver, and tissue as well. So I was in Manchester recently at the Swaminarayan Mandir, talking to them about organ donation, and somebody asked me a question, which was about the Manchester bombing. And, when that happened, the victims needed skin grafts, and skin came as tissue donation from somebody else. So, you never know when what you donate is going to be helpful to somebody else. And so I guess the overall message is you can absolutely make such a massive difference to somebody's life by doing this. And I can't stress enough about why it's so important. Right, that's organ donation done. I will take questions at the end, or do you want me to answer any questions now, Panaben?
Entirely to the participants if they want to question you now. Anybody? No, everybody is
So,
shy.
Profile, I
Go
just
on.
have a few questions. I don't know if people are wanting to ask questions, if they can just start typing in the chat, and then I can ask them for
Yeah,
you. So,
sure.
so you mentioned that now the system has changed, so it's all opt out.
Mm-hmm.
But you mentioned that actually, even if it's opt out, families can override that decision.
Yes.
So, from your knowledge, what primarily is the main reason why families will override the decision? What do you know what the normal reasons are behind that?
So thank you, Shivam. Brilliant question. Whoever's asking that. The primary, well, there are many reasons actually, but the three that I often hear, one is my faith is not allowing me to do this. So the whole question of faith and religion comes into it. So as I said at the beginning of my presentation, faith actually is not the reason, because in our scriptures, whilst organ donation is not referenced directly, doing good for others, doing seva and dan are referenced. And so organ donation is absolutely something our faiths allow. And we should consider it as doing something good for others, that benevolence to others and making a difference to other people. The second reason that often comes up is, a lot of our communities have open casket funerals. So they worry about what the body will look like if we're going to do that. And here, I think what I can say is that, open casket funerals are still possible. The organs are removed with the utmost dignity in terms of the retrieval of those organs. The person donating is given, the best care and treatment, but the family are also given, a lot of support, a lot of dignity, and that time to spend with their loved one beforehand and afterwards, as was the case with Ari, actually. His parents were able to spend 2 days with him, and doing all those last rites as well. So whilst there are multiple reasons, I think none of them are actually reasons. People often listen to fake news, they listen to their what I call community auntie. And sorry, I'm not rude to aunties, absolutely not. But often there is a community auntie who will have heard something somewhere and they're re-repeating that. Or you see fake news on WhatsApp. I mean, I love WhatsApp. It does an absolutely incredible job, but sometimes news spreads really fast through WhatsApp, and sometimes it is fake news. So nothing in our faith says we can't donate organs. Donation in death is done with utmost dignity. So actually, those open casket funerals can happen.
And if we wanted to donate our organs, do we at any point, can we go and get tested for our matches and for our blood types and things like that? Is that something that is recommended? That's what
So,
some people get a bit confused about.
so you're talking about living donation now, are you? You're talking about living donation?
So both actually. So
Okay.
is it useful even if it's not living? Is it still useful to get to get tested beforehand?
So I think for donation in death, testing is not necessary because the medics absolutely decide who you're going to be matched with on the waiting list. But living donation, as I was saying, there are umpteen numbers of tests that are done. Should you step forward and say, well, actually, I'd like to consider this. And one other point about living donations, you could donate your kidneys and your liver while you're living, because the liver will regrow. And most of us have two kidneys, but only need one to live on. But what for living donation, one of the things that people often get confused about is they say, well, actually, I only want to donate to someone I know. But there are lots of people who donate to people they don't know. So we call it altruistic donation, where they'll just step forward and say, well, I'd like to do this. And that donation actually allows some of these chains to happen because somebody has stepped forward, not knowing the person in need, but that still want to donate. So yes, absolutely. If you're stepping forward to do that, you will be tested for all sorts of things and we'll do all sorts of tests from blood tests to scans. But for donation in death, no, because the medics will absolutely take care of all of that and decide who you are matching with or not matching with.
I think Damayanti Ben had a question. I'll just unmute you. There we go.
Thank you very much. It's a very good, informative subject this is. My question is, I have donated my body after death, but I'm a cancer survivor. And am I right in thinking that they cannot give my organs to anyone, but they can use the body as for medical research and for students to do whatever they need to do and like cut up and like use tissues or organs or to learn for the like am I right in thinking that?
It's for teaching colleges,
Teach,
yes.
Yes.
yeah.
So very good. Bless you. Thank you for doing that. And absolutely. So they're two different processes. Donating organs means it helps somebody on the waiting list to actually receive an organ that saves their life. Donating your body for medical research means that medics learn from that and you would donate through a different process. And either is an amazing thing to do, but I always say to everyone, if you're healthy, then do organ donation because that organ will save somebody's life. But they are two different processes.
And just to clarify, Prafula, Damayanti Ben is absolutely right that there's in certain conditions that you have during your lifetime, and if you've had chemotherapy or radiotherapy, and there's certain organs that you won't be able to donate. coming from my perspective, so at medical school in Nottingham, we have full body cadaver dissection. So people have donated their whole body.
Yeah,
And I can tell you that in all the time that I was there, I didn't see one South Asian donated body. And and although you're not directly, I say, kind of saving potentially someone's life, you are helping hundreds and hundreds of medical students that will become doctors, and those are hundreds and hundreds of doctors that will go on to then help and save people's lives in their time of need. So I must say that it's a we're absolutely crying out for people from especially Indian and South Asian backgrounds to donate their body after death so that it can be used for medical research. In particular, you can actually contact the universities and medical
that's right.
schools. There's very, 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 very strict guidelines for these now. So
Yeah,
it takes actually a very long time for these things to be processed. So what I would say is if anyone is interested, contact a medical school as early as possible and try and find out their particular way of doing things because
yeah,
they're very, very strict and even when you when you receive a cadaver for the medical school, um, the protocol and the guidelines there are extremely, extremely strict. So, for example, it's technically illegal for anyone to actually take a picture of a body or to or for anyone else who is not a medical student to see or view the body. And
yeah,
most of the time, actually, the body's face is also covered up sometimes, depending on preference as well. But most of the time, it just for dignity's sake. So that
yeah.
just gives you a bit of a background from someone that's actually been there and done that.
Well done, brilliant. And I will add one other thing. You can still have a funeral as well. So there is a
Yes.
memorial service you can have, and you can still have a funeral. So both are obviously, I wasn't, a preference one over the other, and both are very good acts of seva and dan. And I get a lot of people when we're out and about doing events. So, for example, we were at Diwali in Trafalgar Square recently, and there lots of people came and asked about exactly this thing that we've just been discussing, donating your whole body for medical research. So I'm sure it is happening, but maybe not in Nottingham. I hear about it in London quite a lot. We've
The,
got other
the other
hands.
The other thing you mentioned, Profila, is that you're absolutely right in terms of the funeral. So as soon as the body has been used for the medical research purposes, there will be official funerals that take place. And actually, as medical students, we actually generally attend those funerals if the family wish as well,
Yeah,
just to say thank you to the family and to pay our respects as well. So it's
yeah.
like I said, it's a very, very kind of stringent process and people that are interested, I'd say contact as early as possible is my biggest recommendation.
Brilliant. Right. I'm going to take one final question, then I want to talk about lung cancer, which is quite important as well. So, if it's okay with you, Panaben, I'm happy to answer questions offline as well. And you could take that, maybe make a note of them.
Okay, just one question. Many Asian families hesitate to sign up as an organ donor. What are the biggest misconceptions you come across, and how can we overcome them?
Okay, so really good question. First misconception we talked about is my faith doesn't allow it. So my religion says no. Second one often is that community elders are the gatekeepers of this decision. So people will often say, oh, I was talk to my grandmother or my grandparents or my mother. And this is why it's really important that people of all age groups actually understand the information about organ donation and make their own choice and their own decision. So those are two main, reasons we hear why people don't want to do it. And the third one, which I've also alluded to already, is the one about, what will the body look like if we have an open casket funeral. There are other misconceptions. So often we get asked, can I choose who my organs go to? Well, no, you can't choose that. The medical community, i.e. the medics in the hospital, will choose who your organs go to, because it's about who is the best match, who has the best chance of survival after the transplant. Because the transplant, as a given, is something that will happen, but we also must remember that actually some of this is about some of this is also to say, well, actually we will do the transplant, but then the person will be on immunosuppressant medications throughout their life. So that is to make sure that the transplanted organs are not rejected by the body, because the body thinks that is a foreign part in their body, and often it rejects. So the medics will decide who has the best chance of survival from those organs. So we can't choose who they go to.
Thanks very much for that. Do you want to continue on lung cancer, please?
Yes, so I will share my screen. I've got a few slides, and this presentation is, I'm not a medic, so I'm doing this very much as a community member who wants to raise awareness of a specific cancer. We've been doing a lot of work on cancers in the Oshawa community recently, and I wanted to just share this one piece of information about lung cancer specifically, if that's okay.
Mm-hmm.
Okay, I don't know if you could see my slides yet.
Yeah.
Yeah. Okay, so as I said, we're going to talk about lung cancer. Oh,
Yeah, that's better.
yeah, right. We're going to talk about lung cancer today, and I want to talk about just three things: understanding lung cancer, so signs and symptoms, the lung cancer screening program, and the link to smoking, and why it's really important that we seek help to stop smoking. So lung cancer, we may not know this, but actually it's the third most common cancer in the UK, and there are currently 28,000 cancer deaths in the UK every year. Knowing these symptoms and early detection are really important because it is treatable. Often, and here we know that 57% of lung cancer patients in the UK are diagnosed very late, so at stage 4. And that often means that there isn't curative treatment for that cancer. But if you were diagnosed at stage 1, you have the chance of treatment, and the survival rate is around 90% of people, if you had the treatment at stage 1 compared to 4% at stage 4. So it's really important to understand the symptoms and perhaps, have the diagnosis much earlier on. More than 70 out of 100 lung cancer cases in the UK are related to smoking. And screening does save lives. So here in my presentation, there's a link to the lung cancer screening program for West London, which I will share with everyone separately. And when I say smoking, it's not just cigarettes we're talking about, yeah? What is included here is cigarettes, pipes, and also shisha. And it's not just you smoking. You can be somebody who actually, it doesn't smoke, but is affected by other people's smoke. So we call this passive smoking. So regardless of whether you smoke or you don't smoke, passive smoking can also have this effect. And so what are the symptoms? The symptoms are a persistent cough that lasts more than 3 weeks, feeling breathless for no reason, repeated chest infections, and despite having treatment, no improvement. Sometimes unexplained weight loss or loss of appetite, coughing blood, or blood in the film that we bring up when we're coughing. and the cough that changes or it gets worse with time. And this last one you might find quite surprising, but chest or shoulder pain. So shoulder pain obviously can be for a number of reasons. It could be a muscular complaint, it could be an injury, but actually unexplained shoulder pain can also be a symptom of lung cancer. Less common symptoms, are back pain, wheezing, a voice that gets hoarser and hoarser, and finger clubbing, which is, when the tips of your fingers swell up, sometimes difficulty swallowing, and sometimes swelling in your face or your neck. So if you have any of these symptoms, and the coughing particularly, so if you have a persistent cough that doesn't get better and keeps returning, it's good to get checked by a GP or a healthcare professional. And often we are told that actually if these symptoms persist for more than 3 weeks and they're not related to a normal common cold or flu, then you must go and seek medical advice. As I said earlier, smoking is one of the leading causes of cancer, lung cancer, and this includes tobacco products. So as I said, cigars, pipes, shisha, and cigarettes. And people who do smoke have a greater risk of lung cancer, an increased risk of lung cancer. And depending on how many cigarettes you smoke a day, it can be a greater risk or a lesser risk. And this is why NHS has now launched lung cancer screening program for people who have a history of smoking or are current smokers. And this includes people who may be in environments where, they are breathing other people's smoke, what we call family smoking or passive smoking. People with a family history of lung cancer or their immediate family members who have been diagnosed should also get the screening done. And this is completely independent of whether you're a smoker or you're not a smoker. Some places of work, so workplace exposure, and this includes chemicals such as asbestos, silicone, nickel, and manufacturing such as glass making and farming could also be reasons. And you might have seen that other reasons include things like exposure to diesel fumes. We're all always told actually about the quality of air around us, and particularly from vehicles and vehicles that are idling when the engine is on, but you're going nowhere. So some of these are also risks of lung cancer, and air pollution, whilst not 100% proven, is one of the reasons that is often cited as well. There are other risks, so eating a poor diet, not exercising, leading a sedentary lifestyle. Some studies suggest that some of this is also a contributing factor. Consuming red meat, processed meats, alcoholic drinks could also increase risk of cancer. But currently, there is no evidence that specific foods can cause this disease. And other studies have found that people who do not exercise or sit for at least 8 hours a day and are physically inactive could also be greatly impacted. So what should we do? Well, of course, we should know, first of all, the symptoms and understand the symptoms and how we are feeling ourselves. And then we should contact our healthcare professionals, GP, etc. And the GP may decide on several courses of action. So they could suggest a chest X-ray or a scan, so a CT scan, which we often hear about. And in fact, I talked about it earlier in my talk about organ donations. The CT scan is very important. And then the hospital will advise on what the next steps are. I've got a few tips here to share with you, which we have been given by the Royal Marsden Partners, the Royal Marsden Hospital, and the NHS Cancer Alliance. So they say that depending on your smoking status, be very honest with the GP and how do you have that conversation. So if you have a family history of cancer, and particularly lung cancer, just let the GP know. They will talk about your weight management. They are going to talk about your alcohol intake. If you have a learning disability or another mental condition where actually assessing your needs might be difficult, tell them. If you have a mobility or physical impairment, they also need to know about that. And the final one here is very, very important for our community specifically, which is if you need a translator, please tell the GP. Because often sometimes elders of our community go to the GP, may not understand everything. So it's good to have that facility of a translator with you. The screening program. So this was introduced last year and it is available to people in Northwest London at, various hospitals here. And often there are no signs or symptoms of lung cancer at an early stage, but the screening will pick it up. So if you're in doubt and you think, oh, I've been a smoker I was a smoker for 20 years, I haven't smoked for 10 years, I'm, now in my 50s, my 60s, you can ask for this screening. And it's very, very painless. It's like the other forms of screening that we go through. Currently being rolled out across England and available to people 55 to 74 years of age. Older people can actually ask for it. Older than 74 can ask for it. And they're basically figures to say that actually 75% of people who've been diagnosed with lung cancer through lung cancer screening program have been caught at stage 1 or stage 2. And you remember what I was talking about earlier when we were talking about stages. So we get to stage 4, it isn't curative. There won't be a treatment, but if you are at stage 1 or 2, treatment is possible. And then the screening process, so it's a 2-part process. You'll receive a letter, which is your letter of invitation to take part in the screening program. And then patient care advisor, so it will be a non-medical professional person who will take some details from you over the phone, which takes about 15 minutes. And this will be a series of questions that you'll be asked about your risk of lung cancer. And then you might go and have your screening at a portable screening unit like this one in the photograph. And they are usually in the hospital, sited in the actual hospital grounds somewhere. And this will be an in-person appointment, which is a CT scan, very low dose of radiation, and where the computer will take some detailed images and pictures of your lungs. This appointment is usually with the respiratory nurse at the local hospital, like in a unit like the one I've shown here in the photograph. And then you'll get your results, a few weeks later. Now, smoking. We have Harrow Health or Brent Health Matters. Both are working on massive, big non-smoking cessation programs. But smoking is not only bad for you, actually, it's really bad for your wallet. We just did some really quick calculations. It costs about £49 a week. And by quitting, you're going to save about £2,500 a year, depending on how many cigarettes you smoke. Smoking also raises the risk of other problems. So if you're type 2 diabetic and you're a smoker, it raises your raises your risk of having other health conditions as well. I think there are lots of toxins that are going into our body from smoking. So actually, if we can use any of these programs that are available to stop smoking, it's really good to go and seek advice and use those. Pharmacists can advise on what might work for you best personally. So can your GP. And then there's some information in this slide about quitting smoking, why it's really important and the benefits of it, and then better physical health. So if you smoke and you quit smoking early, you are likely to benefit. It's never too late. You can stop at any time. I'll give you an example. My father was a 40-a-day man, and then one day came home from work and he said, he was banished to the garden to smoke. We didn't allow him to smoke in the house. So one day he came home and he wasn't going out in the garden. And I said to my mom, what's wrong with him? And my sisters and I were talking, oh, Dad's not going out to have a cigarette. And he came in the house and he said, I've decided to give up. And just like that, he was smoking 40 cigarettes a day. And one day he just woke up and said, I'm not going to smoke anymore. And he gave up. So it is possible at any time to give up. Of course, you're going to, find it hard. And that's why there's so much help around, so much support around from pharmacy, GP, and places like Brent Health Matters and Healthy Harrow as well. And then I think some people say, I stopped smoking and I've noticed some things. So they've noticed that their sense of taste and smell has improved. They're breathing better and they have more energy. So these are all the good benefits. There's a link here in my presentation about the different benefits of smoking, and this is from the NHS. I will put all these links in the chat for people afterwards. And of course, it reduces your long-term risk of cancer and lung cancer. And, they've said that lung cancer, heart disease will be also reduced. After 1 year, a risk of heart attack halves, and after 10 years, it falls to more than half of those who smoke. So there's definitely, obviously, benefit in doing this. It's also likely that you may develop type 2 diabetes or problems with bones, so osteoporosis, eye disease, and dementia are also some of the risks. And this is all from the NHS. So as I was saying earlier, I'm not a medic, I'm not an expert in this. All of this information has been given to us and we've been trained by the Royal Marsden Partnership to do these presentations in the community. Of course, our mental health is going to be much better, and dealing with stress, anxiety, all of this gets a boost, and some evidence is there that even at the withdrawal stage of quitting, some people may experience some other, symptoms of anxiety or reduced anxiety. I think stopping smoking is definitely one way to reduce our risk of lung cancer, but there are others, and the others include, us going around places where people are smoking, even though we are not smoking. And that's where we referred to passive smoking earlier. I mentioned earlier the smoking cessation program. So these are run by NICE through people like Brent, organizations like Brent Health Matters and Healthy Harrow. And all I'll say is if people want to understand this more, there's lots and lots of information available. And we're not just talking about cigarettes here. E-cigarettes and vapes are also included in this list of, things that we have to quit. And then there's this really lovely campaign, which is currently on an app, and it's called Smoke Free for London, and it's on an app, and it's basically helping Londoners to quit smoking. And this is a currently running campaign for Londoners, and it will be rolled out nationally shortly. Around our banners and bus stops, we're going to start seeing some of this advertising. Roy Castle had lung cancer, and his family set up the Roy Castle Lung Cancer Foundation, and they've been involved in developing some of this work with the NHS and the lung cancer screening program. So you're going to see these advertising posters at bus shelters, on the big poster sites. And so when you see it, basically that's what they're promoting. the screening campaign. And that's me done. So if anyone's got questions, I'm happy to answer them, but with the health warning that I'm not a medic. Sounds like Shivam is. So we might go to Shivam as well.
Can I just ask one question and then I can hand over to the participants? Somebody's got. Anyway, lung cancer is often diagnosed late. What early signs or symptoms should people never ignore? What are your views on it?
So I think blood, when you cough and you bringing up blood in your phlegm, definitely do not ignore that. Generally feeling unwell and sudden weight loss that you can't explain, don't ignore that. And of course, in the presentation, we were talking about a couple of other symptoms, but those are the two that we must not ignore. And that coughing one is also really important because often it gets confused with us thinking, oh, I've had a cold, it's lasted for 7 weeks. Well, sometimes maybe 2 weeks tops, but it goes on and you've had treatment and it still recurs, then don't ignore that.
I just want to mention as well, Panava, with lung cancer. So, luckily within the South Asian community, the incidence of lung cancer is a lot less compared to white Caucasian ethnicity. And you mentioned about kind of roughly 7 or 8 out of 10 people have a smoking history. Also, if you've worked in those industries like Prafula mentioned, so like the dye industry, if you've worked with asbestos, if you've worked in industries like that, even from potentially a younger age, then sometimes that's a useful thing to mention to the GP. And it's really commonly missed actually. So we don't normally mention that, and the patients forget to talk about that, and sometimes that can be really helpful, especially if you've never smoked, because I know that in the South Asian community there's particular groups that, for example, may have never smoked in their life, but may from an early age have worked in particular industries like that dye industry, asbestos, and sometimes that can cause things related to like mesotheliomas are quite common in relation to those industries. So that's something just to bear in mind.
Yeah, and the building and construction industry as well, because often, and I've actually had someone ask me this question, they were replacing their roof, to their garage, and it had an asbestos roof, and the guy thought he'd just do it himself. Please don't.
No.
Because asbestos and actually disposal of asbestos is a very specific piece of work that has to be done by qualified people who will take precautions to do it, because asbestos is a known contributor to this risk.
Absolutely. Panaji, you've got a question for
Yes,
Prafulaji?
I had two other questions, but because you spoke on this subject about cancer, what is the early sign? I think a lot of women after menopause they have a sign of bleeding, little, and they tend to ignore. That is endodermis cancer, and I think that has to be women who are experiencing that they need to go and see their GP and get checked out, and this at early stage can help your cancer instead of leading to further stage 4 or whatever. So that's because there are different kind of cancers. So that's one other thing, because when you say what are the signs of cancer, so that's why I mentioned this. And going on to the lung cancer, can asthma lead to lung cancer? If you got asthma, can that lead to lung cancer?
So, Shivam, do you want to take it or I can?
I mean, do we need to watch out for any signs during at that stage?
So I don't think asthma I don't think there's any kind of published research about. Oh, sorry, there we go. I don't think there's any published research about asthma and its link with lung cancer. I think the main thing, I think that it's an important message that we'll repeat again and again. Smoking is the biggest risk for lung cancer. And the rest of those percentages then get broken down into those people working in particular industries, like we said, with asbestos. The other one is also if in very, very polluted areas, for example, or of lots of indoor pollution. But again, these are very small percentages compared to the ones that are mostly smoking related. So with asthma, it's people. Um, People's asthma can get triggered by smoking and by pollution. So sometimes that maybe that's a bit of confusion there in terms of bits related to asthma. So sometimes people can have asthma exacerbations when they are which are triggered by smoke and from pollution. But I'd say that any cough that is lasting for a particularly long time, and like we said, blood in the cough, and unintentional weight loss. So if you haven't changed your diet and you're losing a few kilograms, that's also a bit of a red flag. And Pana's absolutely right that post-menopausal bleeding is something that should always be investigated. So if you've got bleeding after your menopause, then it's always important to get that checked out with the GP.
I still had another third question. Can I ask that, please?
Yes, please. Go ahead.
You said about body donating. If I haven't done like already done in written like Damyanti Ben has done, but if I'm like last stage ill in hospital and I know that I haven't got time to leave, can it be done at that stage? Can you tell your doctors at that time that if anything happens, I want my body to be used for the medical terms for the students?
Would you like me to say something?
Yeah, go ahead.
No, actually, at the last minute, it's not very advisable. This has to be discussed with the family and it has to be mentioned in your will as well. So it's best to talk with the family and then done it in the will and then mention to your GP as well. Am I right, Shivam?
Yeah, again, I'll just repeat this one more time. So anything related to medical donation, sorry, your body donation for medical research. So for example, for research for medical students and for research in any other form of research, it's you have to contact these medical schools very, very early on because, like we said, there's lots of procedures that you need to go down. So I would, if you are thinking about it, get in touch with your local medical schools. If you're living in and around London, so Imperial, King's College, UCL are the three main ones that you can get in contact with. Try and contact them, and they have particular websites actually or email addresses that you can contact and speak to them about it. So that's what I'd say. But don't leave things like that to the last minute because that's
Yeah.
something that should be pre-planned early.
Yeah. And if you got someone acting for you and you made a lasting power of attorney, make sure you have that written in there as well, because often people, don't have these conversations, but also if it's written down, they will have read it as well. And so your people that you've nominated to take care of you in your affairs will also know.
Absolutely. Uttamji, can we see your face, please?
I'll
And your
do my
question.
I'll give you the question anyway. Two or three related issues appear. One is regarding smoking cessation products, which are available according to your poster free of charge. There are several products to help with smoking, and if one product does not suit you, there are other alternative products available. So don't be afraid to ask for things that suits you well to give up smoking. So, and I would encourage you to do that, and persevere with it, because as it's been mentioned, the benefits of smoking or the benefits of giving up smoking are extremely high. So please persevere. There are several products available: patches, gums, chewing gums, tablets. So all sorts of different things are available. So please go and find that out, and it will help you in the long run. So please do it. The other question is regarding organ donation. I myself live in Wales, and I think the process in Wales is slightly different, because in Wales, all the whole of the population in Wales are opted in organ donation unless you have expressed a wish not to. So we are all automatically organ donate. We will be organ. We will be able to donate our organs. The issue then is the family. The family at that time when you're dead, the family can say no, you see. So the importance of speaking with the family to express your wishes is so important. So that's what I wanted to share in that aspect. And one final aspect, and from the figures, if I understood your figures correctly, you said there were a total of 8,000 people on the waiting list for organ donation.
More than 8,000. Yes.
And about 2,000 are of South Asian origin. So the proportion,
one third roughly.
yeah. So it is really out of proportion actually.
Mm-hmm.
So we Asians should be doing more to help ourselves as well. Your campaign illustrates how important it is for us to be more actively involved in doing that.
Absolutely. Thank you very much. Uttam, I just wanted to come back on your first point. So in Wales, I referred to the law change in England in 2020, in May 2020. So Wales actually did that law change a year earlier, in 2019. And you're absolutely right. Everyone is by default an organ donor unless you opt out. And that's exactly the law change that happened in England in 2020. Okay. During the pandemic, unfortunately. So a lot of the information that should have been out in the public domain obviously got drowned with some of the messaging around the pandemic. But in 2020, England also followed suit and said, actually, everyone is an organ donor unless you opt out. More recently, Scotland and Northern Ireland have also had the similar law change. So actually, all the nations now are following the same system, which is opt out. And previously used to be opt-in. So you signed the register and that was you opting in to say, actually, I will do this. Now, opt-out basically says, I don't want to do this, and you tick that box accordingly. But our campaign, as you've just identified with them, by that imbalance that is there, we need to balance that a bit better in terms of takers and givers. So we can't just be takers, we've got to give as well. I mean, if I was doing this face-to-face, I do a really lovely quiz, which is all about what will you take and what will you give? And we often see that imbalance even in the quiz. So I think we must become more attuned to our spiritual principles of dan seva, benevolence, and giving to others and making others better. And organ donation absolutely fits into that philosophy. So 100%, our campaign is all about that, and let's better that balance a little bit. And we are actually coming to Wales with them in February. So if you're anywhere near Cardiff, come see us. We'll be there.
I'm nearly 200 miles away from Cardiff, so I'm near in northwest.
Okay, where are you? Where's 200 miles away?
Well, we are more towards Liverpool end.
Okay. I was in Liverpool last year. Well, no doubt we'll be going back. Yeah. Good. Okay.
But thanks for correcting me. And so that's that. So it's important, as you highlight, that the laws have changed. But during the pandemic, I think people were more concerned about COVID than anything else, I think.
Absolutely. Okay. There's another question. So can you mention about care after donating organs? So I'm assuming, Chandrakant, by you're referring to living donation and care. I'll talk about both. So for me, after donating my kidney, I was off work for 8 weeks recovering. I was out of hospital on day 5, and I went back to full-time working after 12 weeks. The only thing that I wasn't allowed to do during that time was drive. So I was not allowed to drive for 8 weeks. And that's a really important restriction, because if you have to do an emergency stop, you may actually affect the surgery, and that's the reason not allowed to drive. Other than that, nothing has changed for me. I eat what I want. I do what I want. I obviously am not climbing Kilimanjaro or anything like that, but everything else is good. I have a yearly checkup to see how my remaining kidney is doing. And I was quite surprised recently because I had my annual checkup. My remaining kidney is actually growing, so it's compensating for the one I no longer have. And by Bhagwan's grace, everything is good. I'm really well. For donation in death, the family are offered a lot of support afterwards. So they are taken care of in terms of conversations and looking after their mental health. And some people are encouraged to tell their story, like Sina and Jay have done. And I have another colleague, Lisa Wilson, who tells an incredible story of her son, Tom, who died 10 years ago. He was a hockey player, and he had an accident playing hockey, and she donated his organs. And it's his 10th anniversary this year, Christmas. And so she's telling his story on the 10th anniversary, and, has become a organ donation ambassador, telling his story wherever possible. So families are encouraged to talk about it. If you're a recipient, you have the option to write to your donor's family, and often you won't know who they are, but you can ask the donor centers and they will share that information with you, and you can send them that in writing. Those letters are really important, and they really are received well by the donor families as well. So yeah, aftercare is definitely there. It is offered in both situations. And I continue to be looked after really well by the Royal Free Hospital. And at this point, I will say a huge thank you to our NHS, because without them, none of this would be possible, right?
Very true. So, if people remember just one thing from today's session, what should it be?
It should be get the information, both about the topics I've talked about. For organ donation, make the decision and make that your decision, and then tell your friends and family about it, because you still have the choice, and make sure you make that choice. And for lung cancer, I think the sooner, if there is this thing happening, then the sooner it's diagnosed, the better chances there are of treatment and survival.
It's incredibly important to talk to the family, like Prafula mentioned, because if you get to that stage and you've never told family members, like we said before, can override the decision. They absolutely have that right to. But if you've told the family members your wishes, then actually those family members can tell healthcare professionals and doctors that actually my family member would actually have liked to donate their kidney or their organs or their body, they will respect that decision, and they will only know that if you've had those frank and honest conversations. So maybe another take home message, Professor, is like you said, making these conversations more prominent in the community, and actually being able to talk about it, and trying to find one particular family member, for example, where you can sit down and have these quite kind of frank and open conversations as well.
Absolutely. So the community often hides behind, oh, we don't want to talk about death, so we're not going to talk about this. You know what? No one wants to talk about death, but this is a very important conversation that we must have with our families, so they know what your wishes are and they can respect those wishes.
Thank you so much, Prafula. It's been really amazing, the kind of work that you've done. And I think Pana and everyone here at GAA, we're so grateful to have you. And it's been absolutely incredible for you to share even your story as well. So thank you so much.
Yeah, today we learned that organ donation is not just a medical act, it is an act of deep humanity, kindness, and courage. We also understood how important it is for our community to talk openly about health, screening, and early detections. especially around issues like lung cancer, where awareness truly saves lives. So, Prafilaben, your personal journey, your dedication, and your clarity have touched all of us. You've helped dispel myths, answer difficult questions, and most importantly, shown us how each one of us has the power to give hope to another family. So, to everyone here, let this session be a reminder that seeking help is strength, knowledge is empowerment, and awareness builds healthier communities.
Thank you so much, Banab. And can I add one final thing? So we talk about a lot of health conditions, and often in our communities, those are stigmas. Yeah, people say, "Oh, mananati kaitu, I'm fine." Actually, you know what? Talk about it openly, because it's okay to not be okay. You know, and the more we don't talk about it, the more we don't have the medical communities find those treatments as well. So parts of our communities are very bad at, being parts of research programs, and all of that is also really important, because unless we're part of the research programs, they're not going to find treatments that actually work for us in our communities. So that's kind of my final message, that it's okay to not be okay. If you're not well and you have these medical conditions, then tell somebody, because you don't need to do that alone. Yeah.
No, absolutely. So, on behalf of GAA London, thank you for being part of our final webinar of 2025. We look forward to continuing this journey of learning, awareness, and community well-being with you in the new year. So, look out for the link, and wishing you all good health and peace and positivity. Merry Christmas to you all, and take care. Thank you.
Thank you. Wishing you all a very festive, nice
You too.
Christmas.
Thank you very much. Take care. Good night. Shubharatri.